My name is Wambui Waithaka. I'm a doctor. I'm stationed at PCA Tumutumu Mission Hospital. I'm also an official for the Kenya Medical Practitioners Pharmacists and Dentists Union. This is the first doctors' union in the history of Kenya. I'm the post of the National Treasurer, and I really enjoy that activism work. The biggest challenge of healthcare in Kenya is lack of facilities. We are trained so well, yet we lack infrastructure. We lack facilities. So if someone who has surgical skills goes to a hospital that has no theatre, working in an obstetric hospital, in a labour ward without gloves, we know which drug to prescribe, but we're unable to prescribe it because we know our pharmacy doesn't have drugs. There's so many cases, and you hear them, so many cases of patients losing lives for nothing because we lack certain facilities that are standard requirement for any hospital. When I was an intern at Kenyatta Hospital in the pediatric ward, and there was 5 patients who were sent up to the ward. I was the only doctor in the ward that night, and there were 5 children that needed resuscitation, and there were only 2 oxygen outlets. It reached a point where you actually have to choose. It was the breaking of my soul, so that triggered me, and I said that should not happen to any doctor again. More so, that should not and never happen to any mother ever again. Civil service, doctors, their life is so hard. The pay is so little, training is so poor. So many of them leave government service every year. Unfortunately, right now as we speak, we only have 2,300 doctors in public service. That's 2,300 doctors serving 40 million Kenyans. With all these frustrations, a group of like-minded people came together and said, we really need to do something. Something's got to give. We're tired of writing death summaries of our patients. We're tired of running 6 hospitals and you're only 1 doctor. We said something's got to give. So we started to talk about it and talk loudly. Then one of the people who had us talking was a unionist and told us, why don't you form a union? So we formed the Kenya Medical Practitioners Pharmacists Dentists Union. We came together, we rallied doctors together, we recruited and recruited. For over a year, we were recruiting doctors, telling doctors that they need to speak, that this is not okay. It's not okay. The status quo cannot stand anymore. We went on strike on December 5th, and we were on strike until the 12th of December. We were able to bring healthcare to the fore, got people asking questions as to why is this thing like this. What was surprising that most Kenyans didn't even know that the state of healthcare is so bad. Kenyans pay for healthcare out of pocket or insurance, and they just go to the private hospitals. So no one knows the current state of the public hospitals. So my challenge right now is that the government just wants to do whatever it wants to do. We are how many years post-independence? How can we only have 2 national referral hospitals? They have not been trying. They do not care. Maybe there is corruption, but I just think it's lethargy and mediocrity, no accountability. That's the problem. Those are the challenges we're facing. This is Kenya, it's ours. There's no other Kenya we're going to wake up and go to. So we are taking charge. So I'm very optimistic, and I believe with all my heart and soul that this Kenya right here is going to get better.